This segment is sponsored by Mercy Health Physician Partners. As COVID cases are on the rise here in West Michigan, we're all looking for ways to stay safe by putting off unnecessary gatherings and meetings. But what about doctor's appointments and routine medical care? Is it safe to go to the doctor's office? Dr. Kristen Brown, president of Mercy Health Physician Partners, is here now to talk about why you should not put off medical care and what Mercy Health is doing to keep patients safe. Thank you so much for being with us today.
Thank you for having me.
Well, let's start by talking about COVID. What's the latest? What are the steps that people should be taking now if they think they've got COVID-19?
I'm so glad you have asked this because with COVID, we've learned a lot and a lot has changed since the spring and it continues to evolve and change. And so the more we talk about this, it's just the better. So if people do suspect that they have COVID or they've been exposed, we'd encourage you to contact us by going to our virtual site online where you can complete a form that will be reviewed by a physician within an hour and give you next steps or follow-ups. You can actually schedule your appointment online through that opportunity, or you can call your provider directly and they can walk you through what the next steps would be if you have symptoms or you think you need testing. And that website for to reach us, if you want to go online and look at your options, is mercyhealth.com/COVID-19.
Yeah, we're going to put a link to that on our site too. We'll talk about that in a minute, but let's talk about folks who may have non-COVID symptoms. Is it safe for them to go to their doctor's office right now?
Again, I'm so glad you asked that question. It is absolutely safe. We have taken the necessary precautions to make sure that from the moment you call the office to arrive to the moment that you leave the office, that we're following the CDC guidelines for cleaning, for protective gear, both for the patient and for our staff. And this is so critical because we've seen patients putting off care because of fear of going into the doctor's office. A recent study in the Journal of the American Medical Association in October showed that the US death rates are about 20% higher than expected, and not all of that is due to COVID. Some of it is due to more heart attacks, strokes, or impact of uncontrolled diabetes because people have been putting off care. If you are nervous about coming into the doctor's office, let me reassure you, it's safer than going to the grocery store because of the precautions that we take, the extra cleaning, etc. But also, we can offer virtual visits too. You can have a visit by video or by phone with your provider, your care manager, or a pharmacist if you have questions. And I always like to stress the importance of not putting off vaccines.
We're hearing so much about the vaccine and it holds so much promise and gives you a little bit of peace of mind. What can you tell us about what you know in terms of the vaccine and how we're all going to be able to access it?
Yes, I think we're all so excited for this vaccine to arrive. We have been planning for the past several weeks just how we will receive this vaccine, which requires special handling because it has to be kept very cold until it's delivered. And then we will focus, as the CDC guidelines recommend, on vaccinating those highest risk people first, our frontline healthcare workers, people in long-term residential centers, and depending on the availability of the vaccine, will continue down through the community. I would expect that we won't be able to have community-wide, population-wide vaccination coverage until late spring or summer. But getting those frontline colleagues vaccinated early in those highest risk populations will definitely help reduce the number of deaths that we're seeing.
So important. All right. Well, if you want to learn more about what Mercy Health is doing to respond to COVID-19 and this pandemic that is upon us, check out mercyhealth.com/COVID-19. We'll put a link at 13onyourside.com. Dr. Brown, thank you so much.
Thank you. Have a great day.
You too.